Here we are at the Concord Board of Health meeting. I'll go ahead and we have members present in person and on Zoom. So I'll go ahead and do a roll call of the Board of Health members present, starting with Zoom. So Jim, go ahead.
Present.
Excellent. And then in person, we have
Portia Katie.
excellent. And
Dottie Bernard.
great. And I'm Randy Crane. I'm the chair of the Board of Health. And then also present, we have Moira Carter, public health nurse, Ebony, how do you say your last name?
Sodal.
Sodal, excellent. And Melanie Dineen, our public health director. And then member of the public on the on Zoom, presumably. All right, so we'll go ahead and start with our agenda. So the first item on the agenda after call to order is the approval of minutes from our last meeting, June 18th, 2024, which were circulated ahead of the meeting. If anyone has any comments on the minutes, I'll welcome those comments now. Otherwise, I'll entertain a motion to approve the meeting minutes.
I move to approve the minutes.
Excellent. I have a second.
Second.
Okay.
Excellent. Okay, all in favor?
Aye.
Aye.
Wonderful. Meeting minutes are approved from June. All right, so next thing on the agenda is the public health nurse report. So go ahead, Moira.
Thank you. So you all have in front of you the number of cases for the 6 diseases that I'll be going over. There was one case of hepatitis C. This was not a case that required follow-up assigned to me by the Department of Public Health. There was 2 cases of human granulocytic anaplasmosis, so that and Lyme are 2 of the bacterial diseases that can spread with the bite of an infected deer tick. Those numbers do not come as a surprise. Influenza decreased from back in April. We tend to see influenza typically into May, so that low number also not a surprise. COVID-19, just a slight uptick there, and Dr. Crane, you can probably attest to increase in cases recently. And then finally, tuberculosis, the 6 cases this month were all LTBI, so latent tuberculosis infection, no cases of tuberculosis disease. I did speak with one of the state epidemiologists who has still no concern over this particular number. These numbers do still jive with the national increase in tuberculosis, and not just in Massachusetts, and numbers have been bumping up following COVID, and we're now back closer to pre-COVID numbers, and certainly somewhat of a reflection of the higher migrant population as well. So none of these were assigned to me for follow-up. The cases that typically are assigned to me for follow-up are B1 arrivals. So folks who have tuberculosis sputum or culture overseas that's negative, but an abnormal chest x-ray and approved to travel, but are then expected to follow up with testing and tuberculosis clinic follow-up at that point. So I help with that. Anyone who tests positive under the age of 18 for latent tuberculosis infection, I help ensure that they're connected with care, and then contacts of tuberculosis disease I work with as well. So that really goes over those cases, but are there any questions about that?
None here. Great.
So just a couple things to report in terms of community outreach. The community health needs assessment is just about ready for dissemination. We're waiting on translation into a few languages, but we have our final draft. And thank you to Dottie who helped us with some of that preparation as well. The communications subcommittee, which is an offshoot of the Behavioral Health Collaborative, met last month, and it was our first meeting, and we brought together different members across town to try to work on how we can improve communications relative to the Behavioral Health Collaborative, but also health communication and resources available in town and better communicate that to residents. So we are starting to work on that. And I supported last month another childhood vaccine clinic at the emergency assistance shelter. That is it.
Excellent. Thank you for that update. That sounds like all good work. And very needed. So wonderful. All right, well, with that part of the agenda concluding, we'll go ahead and move on to the housing case to be discussed. For this part of the meeting, we will move into executive session pursuant to General Law, Chapter 30A, Section 27A, which allows the board to enter executive session in order to comply with or act under the authority of any general or special law. Here, the applicable law is General Law, Chapter 4, Section 726C, which makes personal private information exempt from disclosure as a public record. The board intends to reconvene in open session following this part of the agenda.
And the only recommendation from town council is that you then take a vote to do that.
Okay, excellent.
That's new information, sorry.
Got it. And so,
Yeah, I was just about to pop in and say that. So sorry, voice from beyond. Perfect. Thank you.
So the person, that's our town council.
excellent. Great. Thank you for being here, Kristen. Wonderful.
No problem.
To that end, I will I'll hold a vote, please, to enter executive session by roll call. So starting with Jim. You're muted, sorry.
You're
You're
muted.
muted.
Okay, agreed.
Excellent. Portia.
Agreed.
Dottie.
Agreed.
And I agree. Excellent. Okay, so we will pause the recording now, end executive session and continue on with the agenda for the evening. Moving on to the next topic, the chair and board member reports. So I'll start with the chair report. Not much for me, just again, in June did some physicals on residents at the shelter for camp attendance. That went very well, but otherwise nothing to report from me. So we'll go on to the any board member reports. I forgot to do that last one. Anything?
I attended the
Yes.
breakfast
Yes, thank you.
and that was the monthly and meeting. And it was interesting. A lot of the discussion, of course, centered around MCI Concord, its closing and its impact on so many of the different departments and committees. So that was really the talk that was bandied about most. And I talked about the survey coming up and tried to promote a good response rate, saying it would be in print and online. And so we're hoping for a good response.
Yeah, that would be, we'd love to have a representative sample, right? That's gonna be our challenge, is to get people to fill it out. They've done a really good job using Google Forms to make it usable. It's not that painful. I've used a lot worse.
It's amazing what we can do now.
Yeah, we're having a little bit of a hurdle with the translation and how to get, and the cost, and then Heidi Porter, the director in Bedford, actually has a person on staff that is fluent and it's going to translate into Haitian Creole
that's
for
great.
us. So that was a gap that we had with a lot of translation services. That's a language that doesn't translate unless you're, that's your first language. So that's, we're kind of excited about that.
Anything else from the board?
Yeah,
members?
I did want to clarify. So at our last meeting, there was a request for me or someone to join the fund site.
Yeah,
Unless there
their
was an
meeting is
expert.
this Friday.
So I
at 11.
asked the person that I know who's got a background in an environmental remediation. He's unfortunately not available, so I'm happy to do it. I think you said that they are
They are hybrid.
hybrid, okay.
So we could send you the link. It's Friday at 11, this Friday.
And are they monthly cadence as
Mhm.
well? Okay, and just so I understand the scope, it's, overseeing the remediation process?
Correct.
Okay,
So the task force was charged by the select board to define what the town, make a recommendation to the town if they should take it on and what to do with the property.
Mhm.
The oversight committee has been in existence for 20 years,
Mhm.
working with, and overseeing what De Maximus is doing, the EPA's requirement, and working towards like what the remediation. It's very technical. There's a lot of technical information online. Jim, I think, did you ever go to a couple meetings? But it's very involved. There's a lot. I mean, I've been working here 2 years and I'm still understanding the overburden and the contamination bedrock and what's happening. So there we go.
And it's just a liaison.
It's
right?
a liaison to then know what's going on and then report back to the board.
Okay.
What they're doing and what their activity is.
Okay, yeah,
Okay.
I'm happy to do it for the interim until we, find someone with background.
That's amazing.
Yeah, I think what Kurt will probably be interested, he just doesn't want to do both at the same time. He's
Yeah.
on the task force and,
Yeah.
and that's a lot.
Yep.
And I'm hoping that this board will reconsidering that when they meet, because Fridays at 11 is a tough time.
Mm.
But that's when the staff, the people that are there, so if you're there, you get to help say when you're available, like that's but that's up to you.
As long as it's via Zoom, that's fine.
They're hybrid.
Okay,
Mhm.
okay.
I can send that to you.
I'm off this Friday, but Emily's gonna be here and she'll be supporting them to
Okay.
get that done.
No
So,
problem.
you ready?
Yes, go for it.
All right, so top level, from Commonwealth DPH, we got an advisory and some toxicology report from the fish in the Concord River. So do the high level of PFAS, so we sent out and will be posting in the Concord River fishing point access points. That you not recommend anybody consume anything, fish out of the Concord River if you're under 12, not to eat any largemouth bass, and also to eat everybody else 1 fish per month. We also have just received from DEP issues around Nagog Pond and the bromate that is determined, that's an exceedance, and just keeping you guys in the loop about that. Nagog Pond is not on as of today. They are gonna try to bring it online tonight, and that water will be tested. They've done a lot of improvements, and town meeting voted to do even more improvements. So that hopefully will be mitigated, but it hasn't even been a drinking water source yet to date. One of the problems that has been a big topic today is actually, with conservation is water, but also energy conservation, and our demand right now is exceeding our capacity. So we're using more energy than CMLP can make. They have reserve batteries, so we're able to but it's not forever. So conservation, everybody's encouraged to, and then it includes water use. So like the more you use, irrigate, that takes energy. Also our friends at Great Meadows Public Health, we did issue these out in a statement about keeping cool and reminding everyone to stay hydrated and what the signs of ill effects of heat and dehydration can be, which is pretty insignificant.
Yes,
I'm sure maybe some of your ER visits were those folks
very much so.
doing just that. So we're doing our best and to try to figure out how to get that out to folks and keep everybody in good shape. On a top level, it's still pools and camps. Camps are winding down. We have about 20 camps that were 760 Elm Street, which is the paparazzi property. That septic permit has been issued. It's under bid for construction. We have not, and they're demoing. And they're going to build the shell. So what's gonna happen first is the company is gonna build the exterior. And then each of the occupants, so the 4 like condos, it's like condo wise, they'll be submitting to us like the food plan review individually. It'll be like 4 separate apartments. And they'll be treated, each set of permits and everything is working a little bit with the firms, the engineering and the company that's overseeing that developer on their garbage and compost, because they, I believe, will exceed the half a ton DEP standard by the
Mm.
3 food establishments together for and I'm trying to encourage them to have better forethought. Initially, they just presented like every company's gonna have composting. Well, and then one dumpster enclosure in the back, I've seen how that doesn't work.
Mhm.
So I kicked that back to them and said, no, this is Concord and you need to do something and this needs, try again.
Mhm.
With some sort of plan that will be sanitary, cleanable, not attract rodent and pests, but meet everybody's needs as far as oil, reuse and solid waste and, diversion. So I haven't heard the final plan. They've brought it to me twice now and I've rejected it twice, so we're still in progress. But that's the developer that has to develop that, because because parking is tight,
Mm.
it's a shared garbage space, right? It's one dumpster for all 3 food establishments. And I've worked in the communities and I've seen the positive and negatives of both in a condo-wise, like food establishment strip mall like this. And somebody needs to be in charge and it needs to be, because it'll be like, who's gonna leave that and manage that kind of situation?
My only concern was the proximity to the Assabet River.
Yeah.
Water rat and,
All of those things. It's really interesting because, I'll say you need to have the dumpster on a cement pad, it needs to be, and then, natural resources is less cement, less,
Right.
more, so
Different priorities.
we acknowledge that we're saying different things and we have different needs in order, and they have to work with us to make it work for all uses. And that's a lot going on at this site. That is everything in the nutshell. Dominique is working on training. I don't know, I think that's, and anybody have any questions on anything? Both ponds are good still with water quality. Haven't had any cyanobacteria bloom develop that is at risk. White Pond and the bathrooms at Giroux are open.
Oh, that's great.
They opened in June.
Excellent.
What is that?
Drew Park, the, over by Warner's, right? Warner's Pond?
It's on Warner's
Yeah.
Pond. It's a,
Never done it.
on the
Yep.
rail trail.
it's right on the Bruce Freeman Rail Trail.
Yeah.
There's a park. That was developed about the same time as the park at White Pond, but has a pavilion that is still under construction, but a bathroom. And it's a beautiful landscape, like phase 1 is a pavilion and a bathroom, and then select board meeting on Monday night, we'll have an update.
That's exciting.
It's very exciting.
And I guess, so thinking ahead to next month's meeting, you think we will have agenda items for August?
So we could determine that now, like I've been working with town council on and I can't determine what will happen with this the housing case.
Right.
But the tobacco reg can be posted and it's just not done, it's still with town council.
Sure.
I had our tobacco compliance officer, take a look at it and add his couple of tweaks. So it's not ready for this meeting and we could do it, or we could wait till September. So if you're like, if we don't have a meeting, you don't want to meet. What will be on September's agenda is the tobacco regulation. That's up to you, or if you want to have it. I don't know, depending on when they get it to me, it has to be posted 2 weeks.
Mhm.
For it to have a hearing, so it's giving me a little, I don't have it
I can
ready.
wait.
Ideally, it'd be done
Yeah.
right now, and then I had to have a whole month to post and make sure I had the hearing notice out.
I don't feel a strong need to rush ahead with it, necessarily. And I guess maybe why don't we see kind of the timeline of that?
Mhm.
And if there's other business that would need to be addressed in August, but otherwise, if there is no kind of urgent business, maybe we could, skip the August meeting and.
Is there anything needed in advance of like school starting? Or is that?
Not typically. Not typically. I mean, I can't predict what will come up.
course.
Yeah,
And
no,
what somebody
Yeah.
will, in between now and then, request, before, like, let's say, we administratively, like, let's say somebody has a septic review. And our inspector does it, I review it and they don't agree, like we had,
Mm.
people can come to the board and appeal any findings. So between now and the next
That-
board
right,
meeting,
right.
that could happen, cause I can't speak for like what people want to appeal for, right?
Yeah.
So why don't we keep the August meeting on the books, but
Just in
with the
case.
understanding that if there's that I don't feel we would need to kind of rush the tobacco peg.
If the only
Yes.
agenda is, and then,
We could push that, give you more time, and then also just kind of push it back to September that way.
Mhm.
Yeah, that sounds.
And
good,
the only
everybody.
thing I can see, saying if there's
Yes.
some huge spike in COVID,
Sure,
but that's goes unsaid now every month. that,
Right.
You know, the surveillance is.
we have had a little bit more COVID, I would say, in the last couple weeks. It's really,
I heard of a lot
Yep.
of cases.
there's a lot of,
Yep.
um,
I saw there were 18 cases, I think, but
yeah, but so many people aren't getting tested.
I was
Yeah.
wondering, do you, factor it 5, factor it 10 of what the real,
I can't. I haven't looked at the wastewater, for a while, they were testing the wastewater
Right.
stream.
Yeah.
In some municipalities, and that was kind of a precursor, indicator of actually how much COVID is.
yeah.
I didn't look at that data before this meeting, but I do know just, we had test kits that seemed to disappear quite a bit before the 4th, because there's
Mhm.
people in, we had at a meeting that, on-site meeting, everybody at engineering and water and sewer and health and everybody, and a good number of those people ended up, positive with COVID and contacting me, just in town staff.
Yeah.
Mhm.
What do I do? Remind me of the protocols, that
Mhm.
kind of type of conversations.
Yeah.
But I don't believe any of those people went and got tested as
Right.
officially as the count. Like that's
Yep.
that's the metric that's really hard to,
Yeah.
the data came out today, the state did, we're still a low risk, but our Cambridge sample was positive for West Nile of a mosquito.
Hmm.
So everything was just concentrated in the South Shore, and now we're going to see, probably increase concern about arboviruses. It is
Mhm.
only the middle of July, and between now and the first frost. So I keep on top of that, and that would be the only other thing. If there is a problem, we are a spray community. If there is a EEE case,
Mhm.
a human case, most likely that'll be,
Mhm.
but that will be well publicized by the state. We did not opt out of that. We opted to have it if we needed to.
Great. Well, that concludes kind of discussion, and I see no members of the public present, so I will entertain so we'll skip the public comment part of the agenda and then on to adjournment. So I'll entertain a motion to adjourn the meeting.
I move to adjourn.
Second.
Second.
Great, excellent. All right, and all in favor of ending the meeting? Aye.
Aye.